I'm Dr. Asai here with a new sonography discussion on absent fetal stomach. Don't forget to subscribe for every Monday sonography discussion. As absent fetal stomach associates with 85% abnormal outcome in pregnancies, it's very important to diagnose it in anomaly scan. So in this video, we review normal stomach in fetus, its normal anatomical place, not to misdiagnose it with normal gallbladder, and also not to misdiagnose it with normal umbilical vein. We will then have a short review of contracted stomach and contracted gallbladder. And at the end, we will review a fetus with absent stomach. We will discuss its causes and its significance. It is very important not to misdiagnose a stomach with gallbladder. As we can see, a stomach is more posterior and adjacent to left hemidiaphragm, but the gallbladder is locating anterior of the fetal body. Here we can see the gallbladder, urinary bladder is here, gallbladder again. We can see it is more anterior in comparison to fetal stomach here. Here is gallbladder. And here is the stomach adjacent to left hemidiaphragm. The axis of the heart is another clue to localize the fetal stomach. As you know, fetal stomach is in the left side of the fetal body, and the axis of the heart is also to the left side. Another clue is the left kidney, and the stomach is adjacent to the left kidney, but gallbladder is far away from right kidney. Here is the stomach, but here is gallbladder. And here we can see the heart and its axis. In transverse view, we can also see that the gallbladder is more anterior than the stomach here. In this fetus, the stomach is not well distended and it's contracted, but according to its normal anatomical place in the left side of the fetus, we can recognize it. Here we see the contracted stomach in the left side, but the gallbladder in the right side. There is also a hyperechoic rim around the contracted fetal stomach. Here is another fetus with normal distended stomach. In transverse view, we can see the full body of the fetus, and in axial view, we can see the stomach in the left side of the fetal body adjacent to the left kidney. Here is the stomach, and the axis of the heart is to the left side of the body and to the stomach. Again, in axial view, we see the stomach in the left side and a small contracted gallbladder in right side. We should also be careful not to misdiagnose the stomach with umbilical vein in the midline of the body. We can use color Doppler sonography to differentiate them. Here we can see the umbilical vein with flow inside. The gallbladder, which is contracted, is here. Now, before reviewing our case with absent stomach, let's discuss the causes of absent fetal stomach. The causes are physiological emptying, which is the most reason for false positive diagnosis. Keep always in mind that non-visualization of fetal stomach may be physiologic and transient. So we should wait and examine the fetus at least for 20 minutes, as the stomach may be contracted and could not be visualized. The most important and most common cause of absent fetal stomach is esophageal atresia. Now let's review a fetus with absent stomach. We can see the face of the fetus, we can see the heart, and here is the gallbladder and urinary bladder is here. We can see also the umbilical vein and its flow in color Doppler sonography. So according to our previous discussions, we can see the gallbladder more anterior and far away from right hemidiaphragm. We can see the four-chamber view of heart here. The axis of the heart is to the left side of the body, and we should find the stomach somewhere like this. But we can see that no stomach is seen here. Again, I should emphasize that we should have our exam at least 20 minutes long and wait for probable contracted stomach to be distended. So we have gallbladder here, more anterior and far from the right kidney, and adjacent to the left kidney here, we do not see the stomach. Here is the left kidney, but adjacent to it, it should be a stomach, but no stomach is here. Again, in transverse view, we see the left kidney and the left axis of the heart. Here we can see the umbilical vein and its flow in color Doppler sonography. But again, no stomach in left side of the fetal body. We can see the gallbladder here, far from the right hemidiaphragm. If the video was helpful, please like it, and if you have any question, be free to ask it in comments.